Hi, I'm Dr. Pennau with Oral Surgery Associates of Colorado Springs. Today I'd like to talk about in-office intravenous sedation. As I'm sure most people are a little bit anxious to come in and visit and have oral maxillofacial surgical procedures done. That's a normal response and it's very understandable. We offer IV and non-IV sedation options for patients as well as local anesthetic. But to talk about IV sedation, first I'll give you a background of who we are. As an oral maxillofacial surgeon, we go through extensive training postdoctoral in the hospital where we do 4 years of training with other medical specialties and residents, and we spend a significant amount of time doing general anesthesia on regular patients in the hospital. We have extensive training in intravenous line management, medications, monitoring, and postoperative management and care. We're also very well qualified to maintain patients' airway. During IV sedation, most of the medications that we give is in a titrated and incremental dose. When you get this medicine, you just slowly drift off into a pleasant, comfortable, relaxed state. You're not aware of what's going on, and we still use plenty of local anesthetic and treat you as if you were wide awake. Using the local anesthetic also helps reduce the amount of medicines that you need through the IV to stay comfortable and sedated throughout the procedure. We have a full team in here. We monitor you significantly with continuous pulse oximetry. We watch your blood pressure. We watch your heart rate. We watch your EKG. We watch you exhale carbon dioxide through a system called capnography. We have a full complement of medications for any type of emergency that could arise, although that is certainly uncommon. You're more at risk in driving here than you are in having a sedation in the office. It has been proven and is done many, many times every day across the country with extremely high success. Your safety and your comfort are our first and primary goal. Anesthesia is a continuum. There's all the way awake and there's all the way asleep, and there are everything in between. So when each patient comes in, we discuss at the consultation their medications, their medical history, their sedation history, any allergies that they may have, and their desires. From there, we tailor a plan, an anesthetic plan, to meet your needs and keep you safe and comfortable throughout and after the procedure. If you do choose to have a sedation, it's important to make sure that on the morning of surgery, you've had nothing to eat or drink. Oftentimes, we will give you a prescription for preoperative antibiotics or other medications that generally is taken 1 hour before surgery with a small amount of water. That's okay. That's what we'd like you to do. Other people also are taking multiple medications, and make sure at the consultation you ask, or we can discuss what medicines you should or should not take on the day of surgery and how that should be administered. Also, it's important to make sure that you have an escort, both here and home. You can't drive on the day of an anesthesia. Also, it would be preferable that you have somebody that can stay with you that's responsible for the rest of the day just to help make sure that you do well and to help take care of you. If you have any further questions about this, please give us a call. I'd be happy to talk to you and we can schedule a consultation.